Hello, Dr. Murrell. So, tell me about your experience since you got certified early in 2009.
Well, I was certified back in January, taking the Clear Essentials 1 course in January of this past year. And I got motivated at the time to go ahead and do Invisalign. But we started out with a couple of patients, and once I got into those, I kind of bogged down, and the staff wasn't really motivated, and so we decided. I decided to talk to Bryson about another approach, how best we could get this going in our practice, and so he introduced the 30, 60, 90-day approach to me, and helped me by encouraging me to retake the course and to get reintroduced to the subject. And so I did that, and it was amazing how the things that I had failed to pick up on the first time around really, after having attempted a couple of cases, it really came home to me rather quickly on what I was overlooking, and especially on the diagnostic part, being able to look at a patient, to diagnose what the patient's needs were and how best they could be helped with Invisalign. He also talked with me about how to conduct an Invisalign day, and how to motivate my staff and myself to know what to look for in patients, and how to introduce our patients to Invisalign, and how best to encourage them to go ahead. And we scheduled an Invisalign day and planned for it, and sent out flyers to patients that we felt like that would be interested, and also put them out into the general public as well. We were really quite astounded at what the response was. We ended up with about, as I recall, about eight patients that responded and scheduled for the Invisalign day. And so that really got us going and motivated, and it's amazing how quickly once we had a chance to do so many patients at once, how it really brought how to do the diagnosis, how to do the records, how to submit the cases, all that sort of thing, brought that home to us. And as a consequence of that, I feel like that we're very comfortable with the Invisalign program, and by the end of the year, the Invisalign Day was in October, and by the end of the year we had completed, or not completed, but at least initiated a dozen cases. We're at the end of our first week in January, and already this week we've started another case, and I have a consultation later today. There's a very good chance that patient will accept Invisalign as well. So I think we're really off to a good start in 2010.